I'm glad you guys are all here today. I'm on a short rope. So we're going to talk about lipids today. How many of you get your lipids checked like once a year maybe? Okay. No shame. You can fake it and raise your hand. I won't know. Okay? All right. So we're going to talk about lipids today. And one of the reasons lipids are just so important to take into account in your overall health is because lipids in many ways is a major component of vascular disease. Coronary artery, peripheral disease, also affects different organs. If you look up at your screen, here's some various risk factors for developing vascular disease. And we all hear about smoking and diabetes and obesity, but you also physical inactivity and genetics. If you have high cholesterol levels or lipid levels, that can play a role in it, as well as what we eat. Are we eating the right things? So, those of you who've gotten a lipid test, here's what they look at on your lipid test. They look at your total cholesterol, your triglycerides, LDL, which is low density lipids, high density lipids, the HDL, and the very low density lipids. We're going to talk about a few of these and what their function is. And here we go. So cholesterol. Everybody, I think a lot of people, cholesterol has a bad name. It's high cholesterol is kind of not a good thing. Cholesterol has a use in your body. It makes up the cell walls, and we're filled with cells. That's what we're one big pile of cells, okay? It also is a precursor for a lot of steroids, hormones, and those type of things. So it does have a function. Triglycerides. Okay, triglycerides, they're a good thing too. Their main function is to help you store energy for later use. Okay, anybody have, when we get too much energy for later use, that has another name, just yell it out, that's fine. What is that? Energy for later use. Okay, it's called fat. It's a fat thing. So I used to tell people, you know, if you're heavy, you'll have a year's supply when the plague hits, okay? Alrighty, so the food you eat contains calories in a few different forms. You got carbohydrates, you have protein, and you have fat. When you consume more calories than your body can use, it is stored in the form of triglycerides and then converted into fat, okay? Triglycerides is a major type of fat in your body, and it's involved, triglycerides are involved in the transportation of different fats. Okay, here are the two lipids I want you to kind of be aware of. You got HDL and LDL. You're talking about the good cholesterol and the bad cholesterol. If you get your lipid test back and that HDL comes in as low, people think, oh right, low, I got low lipid. No, HDL we want high, or at least in range. Because that is a good cholesterol that transports cholesterol from your arteries and tissues back to the liver and other organs where it needs to be used, okay? Now, low density lipids, that transports cholesterol out to your tissues and arteries. So that, we want that to be a lower number. Ways you can improve your HDL, vigorous exercise. And I know they talked about exercise and being active, but no, exercise, high intensity exercise. Also omega-3. When you pick up your fish oil, and it says fish oil, and it has 1 million milligrams fish oil, look at your label for the omega-3 content. It's not the same thing, okay? So you want to build up your omega-3. You also want to use good fats like olive oil, okay? But exercise is really a good one to bring that up. LDL, let's go back here. Okay, let's look at the different low-density lipid cholesterol kind of range there. If you look at that, see where you fall on your last test. If you looked at that, and you should, you can see what the ranges are that are considered very high. That's above 190. If you're 180 to 189, that's considered high. If you're 130 to, I hope my vision is kicking in here, 159, it's considered borderline high. And then 100 to 129 is considered near normal. Below 100 is considered ideal for people at risk of heart disease. Below 70 is considered ideal for people with very high risk of heart disease. Who are those people? People with diabetes. People who have a history of heart disease in their family or have already had heart disease in some form. So let's look at treatment. You get your lipids back, and there's a lot of bolded numbers on there. You're thinking, wow, not even Christmas yet and my numbers are this high, okay? So lifestyle modification, one of the, I don't want to say the easiest, but one of the big effective changes you can make if you're a smoker is to stop smoking, okay? The other thing is to limit some types of dietary fat. Forego the nacho sauce kind of thing, okay? And then increase your fruits and fibers, get some good nutrition, and the fiber will help also carry some of those lipids out of the body during the digestive process. Use lean proteins, more activity, and control weight and blood pressure control. Now with that weight control, yeah, we're not talking about dieting, we're talking about lifestyle changes. How you look at food, kind of like he was talking about. Change our behaviors. And then there's medications. A lot of people are really hesitant to start medications, and there's some reason to that because medications can have some side effects. However, we're looking at statins, non-statins, injectable, and fibrates. Okay, I just wanted to mention really quick some secondary causes of high lipid. Maybe you weren't born this way, maybe you're eating okay, but some medications can cause secondary changes in your lipids. Renal disease, thyroid disease, diabetes especially, liver disease, even pregnancy can temporarily alter your lipids. Excessive alcohol intake, and then some other disease states can do it too. But also genetics is an important factor. If you have someone who died from a heart attack in their 50s, that's not normal, but it could be something normal in your family that your provider should know about. Okay, who benefits from statins? People who have heart disease, who have had a stroke, or have other vascular disease. Okay, those with the elevated LDL of greater than 190. So look at those LDLs on that lipid test you get. People with diabetes, ages 40 to 75 who have levels 70 to 189 without heart disease, they haven't been shown to have heart disease, those are people who would benefit from statins. The other thing is, say you don't have diabetes, you don't have a history, but there's a calculator that shows your atherosclerotic risk of coronary vascular disease. And if you enter all the information, we're going to look at that in just a second, and you have a 7.5% or greater risk, you would probably be someone who would benefit from being on a low-dose statin. So here's the calculator. It's online. Just put in that ASCV calculator. It looks at demographic. It looks at your lab. So you do need to have your lipid test handy. It looks at your personal history. If you have, I don't know if you can read it or not, but it asks if you have hypertension, if it's controlled, if you're on a medication, are you a smoker? It looks at all the different factors. If you punch in all this information and you are getting a risk factor above 7.5%, you might want to bring that into your doctor and say, hey, would I be someone who would benefit from a statin? The other thing is that statins, you know, some of the side effects that you hear about from people are myalgias, okay? And some people do experience that. However, 65% of people who experience that with the first statin they take will not experience with a different type of statin or another one. So it might be worth considering trying another type of statin to see if you tolerate it or changing the dose. Okay, so here's statins. You have high intensity, and the main high intensity statins are atorvastatin, which is Lipitor, and then Crestor, and those are the higher doses of those meds. The other moderate intensity are still those medications, but at a smaller dose, or lower dose, I should say. There's simvastatin, there's lovastatin, which is Mevacor, been around for a long time, and a couple of other ones that I guess they're not used as widely, but they're listed there for you. And then low intensity, 10 milligram, which is a simvastatin or Zocor, some other ones if you want to look at that. Non-statin therapy. So it turns out you've taken the statin, but you're still not quite to go where you should be, either because you have a other condition that kind of promotes this, or genetics. Sometimes they'll add the Zetia, which is that first medication listed, along. It is not a statin. It works a little bit differently. Other people will take that alone, and that can help also. It's not a statin, so it really shouldn't do the same things a statin did as far as if you had adverse effects. Okay. Some other less known medications, and these are for people that have a family history of a lipid disorder, or they've had vascular disease, they're already on a statin and Zetia, and they're still not to goal. These are other medications. They're injected. Some are once a month, some are once every 2 weeks, to bring that LDL down, and they really do work well. But darn it, they're really expensive, and you'd have to go through your insurance to see if it covers it, and there's a lot of prior authorization. But for a few certain types of individuals, this is a really good, helpful medication. Okay, so I'm gonna, just a few take-home pearls. There are many risk factors associated with lipids. So if you say, I'm not eating any cholesterol, fat, and so I'll be fine, well, look at your history, look at other behaviors, and take it into account in the big picture. Treatments include a healthy lifestyle. If you can stop smoking, which is really a hard thing to do for people, then that would be a really good thing for people to do. If you have diabetes and you're having a really hard time controlling it, you can't, and you're not able to do it with diet and exercise, and maybe your medication needs a little bit of tweakage and you haven't seen your doctor in 4 years, maybe it's time to go in and talk to them, because it's kind of a overall treatment for some conditions that includes addressing lipid issues, okay? Everybody is different, so see your primary care doctor, talk to him about your situation. He may want to check your lipids once a year, he may want to check it in 3 months, he may want to start a medication, he may want you to make a really sincere effort at behavioral modification. Everybody is different, everybody responds differently to medications. So, and then another thing is you can, for fun, go check out that calculator. I think it should be in your booklet, and see where you are, okay? Sometimes if your number's up high enough, that kind of gives you a little bit of reality check that maybe I need to have a discussion with my doctor, and between the two of you, you can come up with a plan. So where are we on time? Does anybody have any questions? I mean, we talk about lipids to death, so I appreciate you coming in here and maybe getting a few details, and maybe we'll encourage you to go in and have a discussion. If you haven't had your lipids checked, maybe it's time to check that out and kind of see where you're at right now. And I would recommend doing that before the holidays hit, just saying, because a lot of times after you've had turkey, mashed potatoes, butter, pumpkin pie, and then we have our little holidays where your cholesterol might come up a little bit elevated on your test. So, okay. Well, then if you guys have no questions, thank you very much and enjoy the